Thank you, Kobe. I really appreciate SOAR and Kobe and his staff. They have done a great job. This is our first event of this kind of magnitude um, from a formal standpoint. So we had a lot of things that we needed to learn, and Kobe and his staff really helped us out with that. So really appreciate that. And thanks, Kobe. It does sound like I've been around for a long time, and it kind of feels that way. So uh, thank you very much for the kind words. But so I'd like to once again thank SOAR, Pikeville Medical Center, my good friend Donovan. He's here. Thank you for your time and effort. And UK, we have got a lot of things going on with UK, we're an affiliate of Barnstable Brown, so we're proud of that. At ARH, on a day-to-day basis, we work with them. King's Daughters Hospital, Team Kentucky with Dr. Stack and your team. We really appreciate it. Um, I'd also like to point out uh, Shayna or Shayna Gray um, with Corcept Therapeutics. She has actually bought our lunch today. Her company is providing us lunch, so we really appreciate that. Thank you. Um, so, like Kobe said, diabetes. Diabetes is really a cancer. We all know about diabetes. We've all probably been affected, just like with substance use disorder. Everybody in their family has got somebody that has been impacted by diabetes. And so I'm no different than that. And one of our points of emphasis of our organization is to work with diabetes. And I have a personal interest because my mom, she had diabetes for over 25 years. And I was had a front row seat of watching her health decline and her daily activities of daily living um, really go downhill. And back in 2010, we decided we had the making of a diabetes center. We had a cardiologist, a podiatrist, a ophthalmologist. We could do the labs there for everybody to have their labs done on the same day. So we decided we would start trying to have a diabetes center. Um, the things that we were missing was a good medical leader and also good nurses, diabetic educators that could help us lead the way and help our patients. And so, with the addition of Dr. Jones, our medical director, he's leading our efforts with that as well. Um, and over the course of years, we tried to find diabetic educators. Forgive me, I know there's a new term for them, but I still call them CDEs. But we really kept looking for CDEs to be a part of our team and do what I call be the stick that stirs the drink. Um, because along the way with my mom, I feel like if she had somebody like what I call a diabetic mother to help encourage her and coddle her and support her and kind of lead the way, I think that she probably would have lived a little bit longer and had better quality of life. So one of the points of emphasis for this is to try to help show the need for more diabetic educators in this area. When I first started looking at it back 10 or 12 years ago, the greatest resource of diabetic educators was along the 64-75 track west and north of here. Where is the biggest incidence of diabetes? It's the Appalachian Trail. And so what we need more of is diabetic educators in this area. And that's the point that we're trying to make here. And we want to, um, you'll hear a lot of statistics, a lot of stories, a lot of instances where it proves that need. Um, so we've been trying to work on it. Now we want to get it done. Um, it's a process that's going to take a long time, but we want to turn the tide of diabetes and really make an impact. And we feel like this is the way to do it. And so thank you, Kobe, for showing off about our event center. So our event center came about by trying to meet the needs of the public of having Halloween events and Christmas events and maternity fairs and fun fest, back to school fun fest. So I'd like to show you. You can look around and see what it looks like right now. Well, let's see. This is what it looked like last Thursday. We had around 1,500 people come through here during a 3-hour time frame for a trunk or treat event. So I'd like to really give props to our staff. Our administrative staff leads the way, but I tell you what, we have very solid soldiers that carries out orders really good, and you don't have to give them orders; they just know what to do. So, all the staff that works for primary care, please stand up. I'd like to give you a round of applause. Thank you for pulling this off. Honestly, the last 2 days was nothing short of a miracle.